Hi, my name is Lacey, and today we're going to talk about the characteristics of attention deficit hyperactivity disorder, or commonly known as ADHD. ADHD can be defined as a neurobiological disorder that affects attention, impulse control, and hyperactivity. It can impact how a student focuses, stays organized, and manages their behavior in different environments. During this presentation, we're going to talk about the DSM-5, characteristics of students with ADHD, prevalence, how it is identified, and we'll also explore instructional techniques and accommodations that support students with ADHD. Understanding ADHD. The first category is inattention. Students in this category may struggle to stay focused. They might daydream, have difficulty staying organized, be forgetful, or be easily distracted. The second category is hyperactivity. This can include excessive movement, like constant wiggling or wanting to get up and move around even when it's not an appropriate time. Impulsivity is a key part of this category. Students may interrupt others, talk more than their peers, or act without thinking about consequences. The third category is a combination. Students will show characteristics of both inattention and hyperactivity. ADHD can be mild, moderate, or severe in some cases. DSM-5. While IDEA is legislation determining if a student is eligible for special education, the DSM-5 is used by medical professionals to diagnose the disorder. Cognitive characteristics. When students struggle with self-regulation, it may make it difficult to prioritize goals, tasks, and stay organized. They may also be forgetful. For example, they may leave their homework at home. Reconstitution is another keyword. This means that students may not connect consequences to their actions or always connect dots, unexpected behavior in different settings. Academically, it's important to note that ADHD is not related to intelligence. The students with this disorder are just as capable as their peers, but they might need strategies and extra support when it comes to schoolwork, paying attention for long periods, and structured environments. If students lack this support, they are at risk of losing motivation in the classroom. Socially, students with ADHD might experience lack of confidence and are at a higher risk of depression. They might have trouble making or maintaining friendships, and unfortunately, students may experience bullying at a higher rate. Prevalence. Statistics vary, but it may be that 1 in 10 children between 2 and 17 have been diagnosed, and it is typical for students to be diagnosed prior to elementary school or soon after joining. Approximately 8.4% of children have been diagnosed with ADHD, and adults are on the lower end with between 2.5% and 4.4% diagnosed. Regarding gender, boys are more likely than girls. However, this is controversial because girls are inherently less likely to be flagged because symptoms shown may be mild. So because of this, we can assume that girls are just less likely to be diagnosed. Identification. There are quite a few steps. The first being initial referral. This is when parents request that their doctor assess the child for ADHD, and teachers might also recommend that parents request that. um, CPTs, they may also be used to assess the student's attention span, but they cannot be the sole test. After that, parents will be interviewed and asked to participate in a rating scale. School assessment. Teachers can use the information that they gain about a student while they're in the school environment. The next is consideration for IDEA eligibility. Medical professionals can determine whether the student falls under IDEA eligibility. And in order for this step to be completed, school staff will observe the student. It's also important to consider the gifted program. And lastly, the final step is a formal meeting with school staff to create a plan that best supports the student. Techniques and accommodations. Some simple strategies include clearly posted classroom rules and maintaining an organized classroom environment. Bright, cute, age-appropriate decor can help create a cozy space that supports all students. Providing calendars can help with organization struggles. Giving students note-taking materials and modeling how you can combine color with note-taking can also support long-term memory and engagement. It's also helpful to have students repeat instructions back to you to ensure that they understand. Other instructional techniques can include not relying heavily on lecturing. Try teaching using multiple methods, like using visuals, hands-on activities, back and forth discussions, and allowing movement and brain breaks. Using a reward system can also reinforce positive behaviors and motivation. Giving advance notice about schedule changing is also critical. These strategies are great for every student in the classroom, but they do make a huge difference when it comes to creating an inclusive environment, especially for students with ADHD. ADHD is a common disorder that affects how students learn, focus, and regulate behavior. With proper identification, students will thrive. It's important for educators to understand ADHD to create a successful classroom filled with engagement, equity, confidence. All teachers want their students to look forward to coming to school. Thank you so much for listening.